The Ford government is a new proposal it says will attract new healthcare workers to our province. But the CEO of Ontario's Registered Nurses Association says it won't work. Matt Ingram is outside Hamilton General Hospital to explain. Matt.
Taz, Hamilton Health Sciences sent CHCH News a statement. They're the operators of the General, which is behind me here. They say they're welcome all efforts to increase the number of healthcare workers here in the province, and they look forward to learning more about what this means for their hospital system. St. Joe's also sent CHCH News a statement saying that they're looking forward to learning more about this and welcome efforts to bring more healthcare workers into the province. He says it will attract doctors and nurses from across Canada.
So these changes, once implemented, will automatically recognize the credentials of healthcare workers registered in other provinces and territories.
Doug Ford says legislation coming in February would allow healthcare workers from other parts of Canada to work in Ontario without having to first register with one of our province's health regulatory colleges.
You won't have to go through any bureaucratic red tape. You arrive here with your credentials. We'll find a job immediately for you.
Ford says no financial incentives will be offered.
Why would anyone working in Saskatchewan or Nova Scotia, where the cost of living is much less, voluntarily choose to move to Ontario to take up a job?
They will not, Matt.
Doris Greenspun, CEO of the Registered Nurses Association of Ontario, says while recognizing credentials from other jurisdictions is a good thing, she believes the proposal won't bring more healthcare workers to the province, saying better pay is what is needed.
Until you fix competitive compensation, you ain't going to fix the nursing shortage because you will not have retention.
Greenspun says nurses from other jurisdictions would begin at the year one level of income, which she says is lower than most other provinces.
We are the second lowest compensation in the country, second lowest.
The head of the Ontario Hospital Association was unavailable for an interview, but in a statement, the OHA says it supports the plan. Niagara Health sent CHCH News a statement writing, "We welcome efforts that would result in a larger pool of healthcare professionals to draw from. While we are still learning about the Ontario government's plan, a pan-Canadian model in principle makes sense given we are competing globally for healthcare workers." The province says the proposed legislation will also allow healthcare workers to do jobs outside their regular responsibilities or settings to help hospitals fill vacancies and respond to high volumes of patients in the short term. CHCH News sent a lengthy list of questions about that final part of the proposed legislation, like how it would work and who would decide who's qualified to work a different job and who isn't. We also asked why anyone would choose to relocate to Ontario because of that issue, the cost of living. We received a response from the government, but they failed to answer any of our questions. Now, don't forget that right now the Ford government is appealing a court ruling that struck down Bill 124. That's its wage-limiting legislation. I'm sure you've heard much about Bill 124 recently. Reports suggest that there are documents from within the Ministry of Health that show that the government knows that Bill 124 is negatively impacting its ability to retain nurses here in Ontario.